You can speak.
That's fine. Yeah. So I have no disclosures of interest. That will be the next slide. Yeah, but the slides are not moving. Sorry. Oh, that's fine.
For the slide.
Okay. Sorry. I always have this, just terrible at technology. Apologies about that. So, type 2 myocardial infarction is defined as myocardial ischemia in the context of an acute illness, usually. And this is due to increased oxygen demand or decreased supply. This can happen due to a number of different causes of supply-demand imbalance. We now know that established risk factors for coronary artery disease and type 1 myocardial infarction are also associated with type 2 myocardial infarction. We also know that patients with type 2 myocardial infarction have poor clinical outcomes with high mortality rates. Despite our increasing knowledge on the presentation and the outcomes of this condition, this remains clinical challenging in day-to-day practice. Furthermore, we lack evidence to support the investigation, but also the management of patients who present with this condition. So to address some of the challenges related to this, the DEMAND-MI study was set up as the first prospective study to systematically evaluate the mechanism of myocardial injury and the role of coronary artery disease in patients with type 2 myocardial infarction. So the study aimed to recruit 100 patients and perform cardiac imaging, coronary and structural cardiac imaging in these patients. From January 2018 to October 2020, we screened 8,000 patients that were admitted to the Royal Infirmary Hospital in Edinburgh with an elevated high-sensitivity cardiac troponin I sex-specific threshold, and we identified 702 patients that met clinical criteria for a type 2 myocardial infarction. After the exclusion study criteria were put in, we imaged 100 patients who underwent coronary imaging through the form or invasive or CT coronary angiography and structural imaging. The majority had a cardiac magnetic resonance imaging, and some patients had an echocardiography. Following completion of the study imaging, all 100 cases were reviewed by an adjudication panel, and the final diagnosis was adjudicating using the fourth universal definition of myocardial infarction. So coronary and structural heart imaging allowed us to reclassify 7 patients, and 4 of these were diagnosed with a type 1 myocardial infarction. So the primary outcome of this study was to evaluate the prevalence of coronary artery disease. And in this study, patients with type 2 myocardial infarction, 2/3 had evidence of atherosclerotic coronary artery disease, and this was obstructive in 1/3 of the patients. We also identified important patterns of coronary artery disease, patients having free vessel obstructive disease, similar to the images, the coronary images, invasive angiogram images that you can see here on the slide. These are all from the same patient, a patient who came in following a fainting episode while at a Zumba class, and her CAF showed that she had chronic free vessel obstructive coronary disease with no evidence of plaque disruption, and she went on to have coronary artery bypass surgery. So the secondary outcome of the study was to evaluate for the prevalence of the mechanism of myocardial injury, also to look at the evidence of imaging evidence of myocardial infarction, and this was defined as late gadolinium enhancement in an infarct pattern on the MRI or regional wall motion abnormality in keeping with ischemia. So this is an alluvial plot on this slide here, and the plot is stratified by the evidence of myocardial infarction, so red for yes and blue for no. And on the left-hand side, you can see the primary cause of the type 2 myocardial infarction. And then the second column is your coronary artery disease stratification, and the final column shows you the final adjudicated diagnosis. Perhaps one of the most striking findings of the study was that slightly less than half of the patients with a diagnosis of type 2 myocardial infarction had evidence of infarction on imaging. We also identified some other patterns of myocardial injury and some structural heart disease, things like dilated cardiomyopathy, hypertrophic cardiomyopathy, valvular heart disease. And also importantly to mention that 1/3 of the patients were identified to have left ventricular systolic impairment. And these brings us to some important clinical implications. So the majority of patients who were identified to have coronary artery disease or left ventricular systolic impairment, this was not previously recognized. And you can see here that as of the 68% of patients who were identified to have coronary artery disease, less than half of these were on secondary prevention or evidence-based treatment. And the same case was for left ventricular impairment. And again, this brings us that there are some important clinical implications with possibility of introduction of evidence-based medical therapy. So in conclusion, coronary angiography demonstrated that 2/3 of patients with type 2 myocardial infarction have coronary artery disease, which was obstructive in 1/3. Less than half of the patients who met the clinical criteria for a diagnosis of type 2 myocardial infarction had evidence of imaging evidence of myocardial infarction, which has implications for the definition of this condition. Most patients identified as having coronary artery disease or left ventricular impairment were not on established medical therapy. So cardiac imaging should be considered in practice to confirm the diagnosis of type 2 MI, but also to guide targeted evidence-based therapies. I'd like to thank the team that worked on the trial, Dr. Chapman, Professor Mills, Professor Dweck, and also just say that we're putting together a supplement that will have all the 100 cases in an online supplement, and it will demonstrate both the clinical presentation, but the imaging studies as well. Thank you for your attention.
Thanks for this excellent presentation. Quick question. Why did you exclude 240 frail older patients?
Very, very good question and good spot. So to be able to, to allow patients to have the investigations, the cardiac MRI, which can be quite a demanding scan, the same for the coronary imaging, we decided that this would be appropriate criteria. As you know from your practice, a lot of the type 2 myocardial patients are frail, elderly patients, so we had to consider that in best patient interest.
Okay. Christian.
Congratulations to your important works. I think it's fantastic to now have also imaging data in our biomarker world, and I think the two methods nicely complement each other. I have two questions for you, if I may. So your main finding that 50% of patients with type 2 did not have late gadolinium enhancement or edema in the MRI. Does it mean they didn't have myocardial infarction, so no cells had died? Or is it related to the limited sensitivity of MRI as a method versus troponin? That was the simple question. And then the second question is, you nicely mentioned, showed a lady with the terrible free vessel disease, and she came with fainting. What do you assume was the mechanism of fainting in this lady?
Thank you very much. Two very, very good questions, Professor Miller. So the first one was regarding the evidence of myocardial infarction on imaging. And this is particularly what we are discussing at the moment and debating. I think it's a very good point. I think it's a very good learning point, because if we think about the diagnosis of type 2 myocardial infarction, at the moment this is a clinical diagnosis. And really what we rely on is on that symptom or sign of ischemia. And the question that I would put is, how important is this when defining this condition? I think that we could rely clearly on the imaging studies that we have from previous data, from previous imaging studies in type 1 myocardial infarction. But this, I think, will be a very important message to take home. Second question was regarding the lady with the fainting. So we went through that case many, many times. It was a clear story of vasovagal syncope with prodrome of symptoms as well. And it well may be that she had a hypotensive hypoperfusion episode that triggered her type 2 myocardial infarction in the context of her established chronic severe coronary disease.
Salvatore.
Yes, congratulations again, Anna. It was really wonderful, research. You concluded carefully that the majority of these patients, they have a coronary vessel disease. But on the other side, you simply concluded there was a kind of a left ventricular dysfunction. Do you mean there is a imbalance because of Laplace regulation that is a stretch in the ventricle? What is the conclusion? That means it's like hypertrophy. Where is this diagnosis coming from? Is it stress or left ventricular function?
Yeah, so it was the left ventricular dysfunction was, some of them was in the context of severe coronary artery disease, so it was a kind of an ischemic cardiomyopathy pattern. There were people also with dilated cardiomyopathy and severe left ventricular systolic dysfunction by imaging analysis and your symptoms by playing on echo and also MRI findings. So it's in the context of that.
Thank you, and I think in the interest in time we'll move on, but that was really excellent presentation.